3 years ago, a woman brought in a 7-year-old Cavalier King Charles Spaniel named Biscuit. He'd been coughing at night, losing weight. She'd noticed him breathing harder after his walks. She'd been feeding him the same premium dry food since he was a puppy, regular checkups, all his vaccines. She was, by every measure, a devoted owner. When I listened to his heart, I heard something that made me go very still, a murmur. Grade 4. His mitral valve was in serious trouble. But here's the thing that stayed with me long after she left that day. When I lifted Biscuit's lip and looked at his teeth, I nearly stopped breathing. Stage 3 periodontal disease. His gums were pulling away from his back molars. The tissue was dark, almost purple. There was a smell, the kind of smell that tells you something has been rotting there for a very long time. She had no idea. His breath had been bad for years. She thought that was just how dogs smelled. It's not. There is nothing normal about a dog's bad breath. And what was happening inside Biscuit's mouth had been quietly sending signals to his heart, every single day, for years. Here's what nobody told her, and what I'm going to tell you today. Because the connection I'm about to describe is something most pet owners have never heard about. Your regular vet may have mentioned dental cleanings, but they haven't had 20 minutes to explain what I'm about to explain. By the end of this, you'll understand exactly what's happening inside your dog's body, and you'll know exactly what you can do about it. Starting tonight, let me give you an analogy that's going to make everything click. Think of your dog's gum tissue as a seal, like the silicone bead around a bathtub drain. When that seal is healthy and intact, water goes where it's supposed to go. Nothing gets behind the wall. But when the seal starts cracking, when it pulls away, gets compromised, water gets in. And once water is behind the wall, what happens? Damage you can't see. Structural rot that shows up later, always worse than you expected. Your dog's gum tissue works exactly the same way. It forms a biological seal around the base of every tooth. When that seal is healthy, the bacteria that naturally live in your dog's mouth stay where they belong, outside the body. They do not get in. But when gum disease begins, and it begins silently, long before you'd ever notice, that seal starts to fail. The gum tissue inflames. It pulls away from the tooth in tiny, invisible millimeters. And those millimeters matter more than almost anything else in your dog's long-term health. Because in those gaps, bacteria colonize. They form a biofilm, what we call plaque. And that biofilm mineralizes into tartar, which I prefer to call cement, because that's exactly what it is. A hardened bacterial fortress, unmovable without professional intervention. And here's the part that changes everything. Every time your dog chews, every time they yawn, every time they drink water, bacteria from that infected gum tissue enter the bloodstream. This is called bacteremia. It sounds clinical. Here's what it means in plain terms. Your dog's mouth is leaking bacteria directly into their circulatory system. Multiple times a day, every day, for months, sometimes for years. And where does that blood go? Everywhere. The kidneys, the liver, and the heart. The inner surface of the heart, specifically the valves, has a remarkable ability to catch things circulating in the blood. That's part of their job. But when what they're catching is bacteria, something dangerous happens. Those bacteria attach to the valve tissue. They colonize it. They form what we call vegetative lesions. Imagine small bacterial colonies growing on the delicate surface of a heart valve. The valve can no longer open and close properly. This condition is called endocarditis, and it is, in many cases, fatal. But even before we reach that severe endpoint, something subtler is happening at the same time. Chronic oral infection sends inflammatory signals through the bloodstream constantly. Your dog's immune system is always mobilized, always fighting a slow-burning war it cannot win because the source of the infection is never fully cleared. And chronic immune activation, the kind that has no dramatic symptoms, no obvious limp, no sudden cry of pain, damages blood vessels from the inside. It stiffens them. It ages them faster than time alone would. This is why studies consistently show that dogs with severe periodontal disease are significantly more likely to develop heart disease than dogs with healthy mouths. Not slightly more likely, significantly. Your vet isn't hiding this from you. They're not wrong about anything they've told you. They just get 8 minutes with you and your dog, and there is a great deal to cover in 8 minutes. What I'm giving you today is the 20-minute explanation you deserve. I've spent 22 years doing this. I've held animals in the final moments of their lives, after everything we could offer wasn't enough. I've stood in operating rooms and procedure rooms looking at damage that accumulated over years. Damage that started small, quietly, invisibly. A little gum inflammation, a little bad breath. Things owners noticed but didn't worry about because nobody told them there was anything to worry about. Every single time, I ask myself the same question: how did it get this far? The answer, more times than I can count, starts in the mouth. Something simple, something completely treatable when caught early, something that was present long before the heart was ever in danger. That is what keeps me up at night. And it's exactly why I'm talking to you right now. When you get home tonight, I want you to do something before anything else. Walk over to your dog, get close to their face, not from across the room, and take a breath. If what you smell makes you pull back even slightly, that is a clinical sign, not a hygiene quirk, not just how dogs smell. That odor is the metabolic byproduct of billions of bacteria actively breaking down tissue and protein inside your dog's mouth. The smell is the alarm. Most owners turn it off in their minds without realizing it. I'm asking you to turn it back on. And while you're there, lift your dog's lip gently and look at the gum line. Healthy gums are pink, firm, pale pink with a sharp edge where the gum meets the tooth. They should not be red. They should not be swollen. They should not be pulling away from the teeth so that you can see more of the tooth root than you should. If you see dark red tissue, or purple or white or gum tissue that has visibly receded, that's information. That's your dog's body telling you something has been happening for a while. Have you ever actually looked, really looked, at the back teeth, not just the front? Tell me in the comments what you found. I read every single one. Now I want to address something I hear constantly in my clinic. My vet mentioned a dental cleaning, but she said it was kind of optional. I need to reframe that conversation for you. A professional veterinary dental cleaning, we call it a COHAT, a comprehensive oral health assessment and treatment, is not a cosmetic procedure. It is a medical intervention, and the reason it requires anesthesia is not to be dramatic. It's because a genuinely therapeutic dental cleaning must go below the gum line. That is where the bacteria are living. The tartar you can see on the crown of the tooth, that visible buildup, is only half the picture, sometimes less than half. The real damage is occurring below, in the sulcus, in the deepening pockets forming between the gum and the tooth root. No awake, unsedated dog will allow you to get there. The anesthesia is precisely what separates a cosmetic scale from a procedure that actually addresses the disease. I had a patient, a 10-year-old miniature poodle named Gracie, whose owner had avoided dental cleanings for 3 years because of the anesthesia concern. Completely understandable. Anesthesia in an older dog is a legitimate thing to think through carefully. When we finally performed her cleaning, we found 5 teeth that required extraction. 5. But here's what her owner told me at the 3-month follow-up. Gracie was playing again. She was eating faster and more enthusiastically. She seemed genuinely younger. Her kidney markers on her blood work had improved. Her owner sat in my exam room and cried. She said, "I had no idea how much pain she was in all that time." Dogs hide chronic pain with extraordinary skill. It is a survival mechanism from their evolutionary past. They don't yelp when their mouth hurts chronically. They simply get quieter. They eat a little more carefully. They stop initiating play. And we attribute it to age, because age is the easiest explanation. If your vet has mentioned a dental cleaning and you've been putting it off, Please have that conversation at your next appointment. Ask about pre-anesthetic blood work to assess your dog's safety profile. Ask what monitoring will be used during the procedure. Ask about the specific risks for your dog's age and breed. Approach it as a medical decision, because that's exactly what it is. Now here's where I want to give you something concrete you can begin tonight. Toothbrushing for dogs is, without question, the gold standard of home dental care. I know some of you are already skeptical. I hear it every week. My dog won't let me near his mouth. That's understandable. Most dogs won't, at first. But here's what the research actually shows. You don't need to brush every tooth. You don't need a perfect technique. Even 30 seconds spent brushing the outer surfaces of the upper back teeth, where tartar accumulates fastest, 3 to 4 times a week, produces a measurable reduction in periodontal disease progression. 30 seconds, 3 times a week. That's the actual clinical threshold, not twice a day, not every tooth. Use a dog-specific enzymatic toothpaste, never human toothpaste. It contains fluoride and, in many cases, xylitol, both of which are toxic to dogs. The enzymatic formula in dog toothpaste continues to break down bacteria chemically even after you put the brush away. It's not just about the mechanical action. Start by letting your dog lick the paste off your finger for 3 or 4 days before you introduce a brush at all. You're building consent, building trust, not forcing a new procedure. I had a patient, an 8-year-old English bulldog named Winston, which is an enormously resistant breed when anything approaches their face, whose owner texted me 6 weeks after our appointment with a short message. He actually lets me do it now. I still can't believe it. Consistency over perfection. Every single time. If brushing genuinely isn't possible for your dog, enzymatic dental gels applied with a finger cloth are a reasonable second-line option. And dental water additives, look specifically for the VOHC seal, which stands for Veterinary Oral Health Council, have peer-reviewed evidence behind their efficacy in reducing plaque and tartar accumulation. You add them to the water bowl. That's it. Nothing more required from you. The VOHC seal is the thing to look for on any dental product you consider. It means the product has completed independent clinical trials and met their standards. Not every product that uses the word dental on its label has earned that distinction. Be specific. Look for the seal. I want to be honest with you about something that has been repeated for decades in the pet food industry. The idea that dry kibble mechanically cleans your dog's teeth. The intuitive logic is reasonable. Hard food, hard teeth, some kind of scraping action must occur. But here's what the research actually demonstrates. Most dry kibble shatters on contact when a dog bites into it. It does not scrape along the tooth surface in any meaningful way. And it does not reach below the gum line under any circumstances. The bacteria colonizing the sulcus, that deepening pocket between gum and tooth root, are entirely unaffected by what your dog eats. I'm not telling you dry food is harmful. I'm telling you that relying on it for your dog's dental health is misplaced confidence. What does help from a nutritional standpoint are dental-specific prescription diets that have earned the VOHC seal. These have demonstrated a 30 to 50% reduction in tartar accumulation in peer-reviewed clinical trials. Those are real numbers from real studies. Certain raw, meaty bones under appropriate veterinary supervision also carry good evidence. But that requires a conversation specific to your dog's health status, their chewing habits, and your household's capacity for raw food handling hygiene. The point I want you to walk away with is this. Do not assume your dog's food is handling their dental health. Have that assumption verified. Ask your vet directly. Have you ever been told by a vet, a breeder, or a pet store employee that dry food keeps teeth clean? Tell me in the comments. I'm genuinely curious how widely that belief is still circulating. And I want to mention one final group specifically, because if you have one of these breeds, everything I've said today is more urgent for you than for the average viewer. Small breed dogs, Chihuahuas, Yorkshire Terriers, Maltese, toy poodles, miniature schnauzers, have the same number of adult teeth as large breeds packed into a jaw fraction of the size. Their teeth are crowded and overlapping in ways that create bacterial traps that brushing cannot reliably reach. Periodontal disease progresses faster in small breeds and begins earlier, often before age 4. My strong recommendation for small breed dogs over the age of 4 is a dental evaluation every 6 months, not annually, every 6 months. Brachycephalic breeds, bulldogs, French bulldogs, pugs, Boston terriers, compound the crowding problem with jaw structure abnormalities that create additional gum stress. And Cavalier King Charles Spaniels deserve a specific mention because they carry a genetic predisposition to mitral valve disease on top of everything else. The oral-cardiac relationship in this breed is not theoretical. There is published research looking directly at the relationship between periodontal disease management in Cavaliers and the rate of heart disease progression. If you have a Cavalier, their mouth is not a cosmetic concern, it is a cardiac concern. Please discuss a referral to a veterinary cardiologist if that conversation hasn't happened yet. Everything I've shared with you today comes back to a single idea. The mouth is not separate from the body. It never has been. The gum tissue, the heart valves, the kidney filtration cells, the liver, they are all connected through the same circulatory highway. What happens at one stop on that highway affects every other stop downstream. The smell, the cleaning, the daily brushing routine, the breed-specific risk, the diet question. 5 different starting points, different doors, all leading to the same room. A body that is not silently processing a chronic infection. A cardiovascular system that is not receiving a daily stream of inflammatory signals from an infected mouth. That is what all of this is working toward. And it is completely, entirely within reach. Biscuit. His owner scheduled his professional dental cleaning within 2 weeks of that first appointment with me. We extracted 4 compromised teeth. We treated the remaining gum tissue thoroughly. She began brushing his teeth 3 times a week with an enzymatic paste. At his 6-month cardiac recheck with the cardiologist, the finding was remarkable. His murmur had not progressed at the rate they had anticipated. His systemic inflammation markers were down. He was coughing less at night. He was sleeping better. He had gained 0.5 kilogram. She brought him in to show me at his next wellness visit. He wagged his tail when he came through the door, something she told me he had stopped doing the year before. She looked at me and said something I've carried with me since that day. Why didn't anyone tell me this sooner? That question stays with me. It sits with me. It is a significant part of why I keep making these videos. I have 22 years of clinical experience, and I've seen what happens when this information doesn't reach people in time. I am not willing to let that continue happening if I have any ability to do something about it. If you're sitting with all of this and it feels like a lot, I understand. It is a lot of information at once. But I don't want you to do everything tonight. I want you to do one thing. Maybe tonight you lift your dog's lip and actually look at what's happening back there near the molars. Maybe you call your vet tomorrow morning and ask when a dental evaluation is warranted. Maybe you pick up a dog enzymatic toothpaste this week and start letting your dog get curious about it. Maybe you look up the VOHC website and check whether the dental product sitting in your cabinet right now has actually been validated. One thing, just one, because every small change compounds. Every day that bacteria is not freely entering your dog's bloodstream is a day their heart doesn't have to fight that battle. Your dog doesn't understand periodontal disease. They don't know their mouth hurts. They don't know that what's happening in their gums is making their heart work harder than it should. They just know that you show up, that you're there, that you care, you have always cared. The fact that you're still watching right now tells me exactly that. This is simply information you didn't have before. Now you do. If someone in your life has a dog and you believe they need to hear this, please send them this video. That is the only thing I will ever ask of you. Everything I've shared today is general information based on current veterinary research and my 22 years of clinical experience. It is not a replacement for your pet's individual veterinary care. Please speak with your veterinarian before making any changes to your pet's dental care routine or diet, especially if your pet has existing health conditions or is on medication. Your vet is your partner in this. Please keep that partnership strong.